Good morning. I'm glad to see so many on the call because I'm sure we're going to get a lot of important information. It's almost the same as having a nice lunch with all of you, but we have some serious things to talk about. I represent part of Pima and all of Santa Cruz County, so we have a lot of senior citizens in my very own community, and I'm safely nested at home.
Very good. Thank you for being here today. And real quick, I'm going to take a picture for posterity. So if everybody could kind of smile. Welcome to the community. Everybody smile. 1, 2, 3. Welcome to the community conversations related with the legislators and our community stakeholders around aging. I want to say a shout out to AARP who hosts our lunch. So thank you so much for continuing to participate virtually. Thank you for your introduction, Andrea, and we will head right to Frank. Frank, go on ahead.
Well, good morning. Glad to be here. Frank Carroll, District 22. The actual Seniorville in Arizona is out here. And as you can see, I've kind of changed my appearance in the spirit of wearing a mask. I grew one. So we have it here. At any rate, glad to be on board, and I will enjoy the virtual lunch, which is keeping the weight off. So that's an upside to the whole situation. Thank you for having me.
Very true. Thank you. Leela, do you want to do a quick introduction?
Certainly. Good morning, everyone. This is a new experience for many of us, and I'm looking forward to it. And I thank each of you for joining our conversation today. I was a little skeptical about how this could work, but we clearly have as many participants as we do when AARP provides our real lunch, not our virtual lunch. And so I'm very grateful for that and grateful for each of you in our communities for doing the great work with seniors and here today to find out even more information about how we can serve that very vulnerable population. Thank you all for being here.
Thanks, Leela, and thank you for championing this issue and helping me co-host this today. So this is a real team effort. And then next, and once again, your order is going to look different than mine. So Jennifer, I'm going to kick it off to you. Would you do a quick introduction?
Hi, everybody. State Representative Jennifer Jermaine from District 18, Tempe, Mesa, Chandler, and Albuquerque. Thank you so much to Senator Carter and Senator Alston and AARP for continuing to host these legislative luncheons. And I look forward to today's discussion, and I'm going to have you on mute most of the time because I'm also homeschool parenting right now.
Well, thank you very much for joining us today. We know it's super busy. Representative Butler, you're not broadcasting a picture, but I see you on my screen, so I'll let you do an introduction. Very good.
Turn on my picture. Hi, everyone. Well, I'm being totally unprofessional and actually scheduled this to be riding my exercise bike to kill 2 birds with 1 stone. Really almost now, as you all know, trying to, mental health is as important as physical health these days. So anyway, I'm glad to be here. I'm going to mute my video because I'm going to ride this bike, but I'm glad that we're here having this really important conversation. And I should say I'm Kelly Butler from District 28, and I'm the ranking member on the House Health Committee. So really working to try to understand what we need to do better and what we're doing to keep people safe. So thanks so much.
You might start a trend there, Kelly. We could do a virtual exercise class and talk about these issues at the same time. So
it's a good way to meet. I'm glad we're here.
Right. And then I think I saw, Rosanna, would you go ahead and do an introduction real quick?
Thank you so much, Senator. I appreciate that. Good morning, everyone. I'm Rosanna Gavaldon, Arizona State Representative for Legislative District 2. And very nice to see Senator D'Alessandro here as well. As the Senator said, we do represent a lot of our aging population, but I'm here to learn and to be hopefully helpful as well. And so I look forward to the conversation. Thank you very much, Senator Carter, for this opportunity.
Well, thank you so much for being here. And thanks, everybody, for being willing to do this. I'm going to scroll through real quick and look for other elected officials. If you are on the call and you are an elected official, you do have the permissions through Zoom to unmute yourself and introduce yourself. From this point forward, I don't see any additional pictures. So there are some phone numbers, and I want to make sure that they have a chance to say hello as well. So I'll pause here. If you're an elected official, please say hello. Okay, I think we have it. And if another elected official joins during the call as well, we will welcome them in and do an introduction at that time. So without any further ado, We have an incredible group of people today presenting, and by no means did we leave anybody out of the list of presenters today. So what we've asked, we're going to kick it off with Dana from AARP. I'm going to ask each speaker to, number one, introduce themselves, quick 1 minute, think Twitter version introduction of who you represent and your role in supporting seniors, and then take 5 minutes to describe what you're doing to support seniors in the state of Arizona. We will pause there and then open it up for any quick questions, maybe 1 to 2 questions per speaker right after they speak. We have next, then we'll have Maddie, then Dustin, then Dave, and then I have a couple of special guests also that will probably want to provide some additional information. And at that point in time, we will open it up for a conversation and more questions and answers. We will utilize the chat feature. So if you have a question, please put it in the chat. Anything that is not answered in today's conversation, we will go back through the chat and email that out, as we will also email out the recording of this video. So without any further ado, Dana, I know you're on here. There you are, Dana. I'm gonna mute myself. If everybody would remain muted while our speakers are talking, that will help with feedback. Dana, I'm going on mute. Take it away.
I think can everybody hear me now? Shake your head. Okay, great. Dana Kennedy, State Director with AARP Arizona. I think more than ever, people are realizing that our #1 focus is advocacy. We are an advocacy organization, and we take our role as that very seriously. So some of the things that we have been doing since this all happened, we have been doing teletown halls. So far, we've done a teletown hall with Senator Sinema. Yesterday, we did one with Representative Schweikert. We have another one scheduled next week with Senator Sinema at her request. And then we're also doing one with Mayor Kate Gallego. And then we are also doing one with Director Wanda Wright regarding their Be Connected program. And we've done those in the past, been very successful to try and reach people in the rural areas. We also have developed a website, aarp.org/coronavirus. It's chock full of amazing information. We realize that people are coming to AARP for a source of valuable information. So we have information on that site regarding technology, testing, resources, facts, fraud, caregiving, financial benefits. We advocated in the very first stimulus bill that checks that went out also included seniors. So we were able to make sure that all Social Security recipients received that $1,200 check. We also advocated to make sure that people did not have to file their taxes in order to receive that check automatically. We are actually starting, we were supposed to be in DC this week with our lobby day. So we are now doing a virtual lobby day. So we will be meeting with our elected officials that represent us in DC. We have also, you've probably seen this, that we sent a letter to the governor regarding transparency in nursing homes. We know that it's really difficult right now for family members. We supported the action to restrict visitation from family members, but we also advocated to make sure that family members were able to visit with their loved ones virtually. So we worked really hard to make sure that there were resources in the second stimulus bill, that those facilities were able to get the technology if they didn't already have it, to be able to arrange for those virtual visits. We believe that it's probably going to be some time before family members are going to be able to visit with their loved ones. So it's more important than ever that that virtual technology is available. We also have launched another program called AARP Community Connections. It's like a neighborhood app kind of, or a website where if you're a senior in need, you can then put what your need is. And then there's also people who can then fill that request. We also have launched with that Community Connections that people can request a friendly call. So we use technology to make sure that privacy is protected, but we've actually trained volunteers to be able to call people who may be feeling isolated or lonely, that they would be able to receive a call, and they could actually arrange for these calls to be weekly. And then we are also working on a virtual platform for a lot of the events that we use to be able to connect people and opportunities to events in their community, including educational opportunities. We also do a national teletown hall every week. So this week is actually going to be on Thursday. People can always find out about all the different educational opportunities that we're doing on our AARP Arizona Facebook page, as well as our website. And we're actually excited because this week on our national call, we're going to have Mayor Kate Gallego, and she's going to talk about intergenerational raising a family with a lot of different people in your home and how they juggle those responsibilities. And with that, I'm probably out of time, so I'll pass it over to the next person unless we're taking questions.
So we will do quick questions. I have the chat box open on my screen, and Mary is tracking the chats. So if you would like to ask a question, you can either type something right here. I will say type here for questions. And if we are, as we're collecting questions, so the first question is, where is the information for the town hall meetings?
So we post those on our AARP Facebook page. That's AARP Arizona. Also, if people follow me on Facebook, Dana Marie Kennedy, I usually post those on my page. And then we also have them on our website, which is the AARP Arizona website. You can just Google it and it will take you to our website. We keep it updated and it's chock full of great information. But I would say following us either on Twitter, AARP Arizona, or following us on our Facebook page, you can get all that information. But they're every Thursday.
Perfect. Thank you, Dana. We appreciate that. And stay tuned. We're going to move into the next speaker. Maddie, I know that you are having technology problems, but you are on the phone. So Maddie, if you could unmute yourself, because I don't know which phone number you are. You're next up.
Yeah.
And going ahead. Thank you. I'll mute
I'm going to try the computer, but it's been a little bit of a challenge. I think Cox Communication is a little struggling in my area. So I'm actually going to share my screen. I'm Maddie Bynes. I'm with the Arizona Association of Area Agencies on Aging. I'm our statewide coordinator, and I just wanted to give you all a view of what the area agencies on aging do and a little bit of what you can access around the state and how you can do that through us. So area agencies on aging, there are 622 area agencies on aging nationally. We cover every single part of the country. There are 8 in Arizona. I represent 7 out of the 8 of us. And I work at Pima Council on Aging. So I'm down in Pima County. But I do represent the whole state. So all the area agencies on aging offer a wide variety of services, but we offer the same set of core services. So we offer home and community-based services like in-home care, services like shopping, light housekeeping, in-home nursing. We also all do nutrition programs, so we provide both congregate and in-home meals. Many of our congregate meals have now switched to a grab-and-go meal delivery service. So people will come up in their cars, an employee will hand them the meals through their car window, and they'll drive away. Unfortunately, this doesn't get to the core of what that program is trying to do, which is to bring extended socialization to people, but it does give people food, and that's really what's most important right now. We also do family caregiver supportive services. So we talk with family members about how they can be supportive caregivers and how they could support themselves through that process. We offer respite care. We also are the long-term care ombudsman throughout the state. So we help mitigate disputes in long-term care facilities. So a whole host of information. One of the most important things that we do, though, is each area agency on aging offers an information and referral hotline, and we're all of the hotlines have certified information and referral specialists. And so you can find that information on the screen in front of you. Some of the area agencies also have a text-in number. Some of them have a chat on their website. I know down in Pima County, we have a resource directory with over 3,000 resources, and there's a COVID-19 resource directory on our website. So a whole host of information. I know Andrea said she would send this out, and I just don't want to take up too much more of your time, but I'm also not sure how to stop the screen share.
I think I can stop the screen share. There we go.
Perfect. Thank you.
Very good. So thank you so much for the list of resources. And really, to those on the call, if you don't know who to call, that's a great place to start because they can connect you with resources as well. The 211 system is also up and working. And so I've had constituents use that number, and then they've connected them to many of the area on agencies and food delivery services as well. So there are no questions in the chat box, but I have a quick question for you. Are you seeing an increase in the number of calls, or have you seen a decrease because people they don't know to call? Are you seeing an increase or a decrease?
No, we've seen, so it's a couple interesting things. So we've seen an increase in the number of calls, I think statewide. In certain areas it might be less, in certain areas it's certainly a lot more. We have seen a shift in what the calls are about. Most of our calls are about people needing groceries and people needing food. So we're very fortunate in the Families First Coronavirus Response Act passed by the federal government. The area agencies on aging got $5.3 million in that to provide additional food services. I know some of us ended up putting extra meals in people's freezers if our food service went down because of sickness. You know, there were a lot of things that we did. We also just got an additional $18.6 million from the CARES Act to be able to provide additional services during this pandemic. So we are available to the community, and just like Senator Carter said, we're your first stop shop. If you have any questions about aging, we're going to help you. If we can't help you, we'll refer you out.
Very good. Thank you, Maddie. Dustin, you're up next. If you could unmute yourself, I will hand the microphone over to you. Dustin.
Hello.
Yes.
All righty. Hi, I'm Dustin Schaefer. I'm the administrator over at Haven of Scottsdale. Haven of Scottsdale is a skilled nursing facility. Our parent group is Haven Health Management, and we have 17 facilities in the state. We're the second largest. What we're doing now, we're kind of the ones in the battlefield, on the battleground. We're the ones protecting our seniors, protecting our staff. And so kind of three big things for us. First thing is staffing. That's the biggest, and I'm kind of speaking general on the whole industry, especially out here just talking with my colleagues. Staffing's tough. We forget that first we had a shortage with staffing to begin with nurses, with CNAs, just kind of our industry. Then you add the pandemic to it, you have a lot of fear that's created. You have a lot of staff that don't see the risk or don't see it, you know, where they can risk their own family, their own loved ones they're taking care of. So we've lost some people in the industry to that. We've had those that have gotten sick. If COVID enters a facility, your staff, if they're affected, they have to be quarantined up to 14 days in some counties, in most of us. I'm blessed right now. We haven't had COVID in our facility. Every day we come to work and, you know, we cheer our staff on, we cheer our residents on. We still have to create a nice living environment for those residents because it is their homes. Two, you know, a big issue with the staffing is that if you don't have enough staff to take care of your residents, then you can't provide that care. We have to know that with isolation patients, with your sick patients, with your COVID patients, that takes a lot more time putting on the equipment, making sure you're doing infection control practices properly. So that's a big part of staffing. If you run out of staff, a lot of facilities have to call registry or staffing agencies. Not only are the costs crazy for that, but the quality there. Are they going to other facilities that may have had COVID? Things like that. So our facility, we've been blessed to kind of have very tough and strict kind of guidance for staff. You know, we want to keep our staff working in our facilities so we can manage them. We don't want to share them. We have backup teams. We have a whole defensive list. Besides the staffing, it's the PPE. We hear this national shortage. We're feeling it here in Arizona. Our company has done a great job at securing contracts. We're the second largest in Arizona, so we've had that blessing. But I've had friends reach out to me from other facilities that don't have it. So they rely on makeshift masks. They rely on whatever they could find, basically, to protect their staff. So that's a huge concern still. You know, with the elective surgeries opening back up on Friday, that's a concern as well, because I believe they have to have a stock of up to 14 days of PPE. So the facilities get hit next with that. And if we don't have the proper gear, then we can't take care of our residents safely. And then kind of the last thing is just testing. You know, the hospitals, they've done a great job at keeping the death down. They've also remained half or less than half full, where the facilities, you know, we have a smaller facility. We have a lot of people congregated together. Many people have 2 people in the room. Many people have 3 people in the room, depending on the age of the facility. So with that, we need testing. If we know that all of our residents are safe, all of our staff are safe, we can prevent the spread of this. So I'd be happy to take questions. I know this is a crazy time right now, a scary time right now, but I'm thankful of all the work that our colleagues have done. When you look at New Jersey, New York, you hear the horror stories, and I think that kind of paints a picture of all skilled nursing facilities. But so Arizona's done a great job.
Well, thank you so much. I appreciate that individual look, and I'm going to kick it right off to Dave so we can kind of compartmentalize this conversation. Dave, would you mind just A, introduce yourself to the group, but then B, kind of see what you're seeing as an industry across the state?
Sure. Yeah. Thanks, Senator Carter and Andrea and the rest of the group here for everybody getting together. This is amazing. It's pretty cool. Thanks for doing that. Dave Vopel, CEO for Arizona Healthcare Association. We represent skilled nursing and assisted living throughout the state. About 18,000 residents who are members, like Dustin, take care of. Haven Health Management is one of our larger members. They do an awesome job, mainly rural folks. We also have Enzyme, Bandera, Life Care. We have also some mom and pops, more or less, that do an awesome job. And think about it from a statewide perspective. There's about 147, give or take, SNFs throughout the state. And DHS is reporting that less than 30% of them have COVID in their buildings. That's pretty amazing. And one of the things that we started early on back in February, which seems like 8 years ago, we said we have to restrict visitations. And working with DHS and Access and the governor's office kind of locked things down so that COVID couldn't get in the buildings, because we saw that once it got into the building, it just ravaged the building. And it's so contagious that it's not even funny. Here's the problem. We don't have the PPE, the staffing, and the testing. Like Dustin was saying, we don't have that. So it's like you're sending CNAs and caregivers, the frontline workers, RNs, those folks that need to take care of the COVID patients, into battle without any armor. I mean, they don't have any bullets. And we're scrambling to continue to get PPE. We received some from the national stockpile, which is fantastic. But once you get COVID in the building, you blow through the PPE. So we've seen throughout the state, there's been some hot pockets, and those facilities are working through it. And fortunately, they've been doing a really good job. So I'll leave it at that and then take any questions.
Thank you, Dave. I really appreciate that. So please put your questions in the chat box. So there's a general question from Erica requesting clarity on 2 issues from any of the panelists who can answer. Are long-term care facilities required to tell all families if a resident who lives there has COVID? And are hospitals allowing family members to be with patients who have dementia or who are nonverbal? We're hearing different stories at the council, and we want to be sure that these individuals have at least one member with them so their wishes are being followed. So if you're on the panel or have information about that, Dave, you've waved your hand, so I'll kick it right off to you.
I can talk to the long-term care component of that. So we are governed by CMS, Centers for Medicare and Medicaid, and by CDC to follow their guidance, along with ADHS, along with the county. And CDC and CMS comes in and tells us, first thing we have to do once you get a COVID patient in there, you have to call the county office and you have to notify them. That's right off the bat. Number 2, you have to notify ADHS. Third, you have to let the families know and the people in the building know. So in answer to your question, yes, you have to let them know. What has been confusing is the time frame. When do you have to let people know? And when do you let them know that there's another COVID in the building? Well, CMS is coming down with more guidance for us on this. They announced last week that within a certain time frame, you will have to let everyone in the building know, residents and their families and their guardians know that there's COVID in the building. You don't say who it is or anything like that, so we wouldn't be breaking any HIPAA laws or nothing like that, but you announce it to everybody and let them know. Same as if you get, if COVID, if more comes into the building, you have to tell everybody again. So that guidance should be down this week for us to follow.
Well, Dave, the questions are flying in, so if you don't mind, I'm going to just chop right through it. And Maddie, I will unmute you while you're answering, and then I'm going to go back to the questions. Maddie?
Yeah, so I just also wanted to say the regulations are really confusing, like Dave said, and we have the long-term care ombudsman to help navigate some of that. So that's a place in which your AAA can help you. It's not one that often people think about, but it's one that we do. And I wanted to jump on the PPE bandwagon a little bit. I know that the area agencies on aging are really struggling. We provide in-home care and we contract with people who provide in-home care. And so it's just so important for us to be able to keep people out of the hospitals, to have the proper equipment to do that. And it's very hard to procure and extremely expensive right now. So something that the state could certainly help with a little bit.
Very good. And I want to get to the questions real quick, back to the questions in the chat, but related to PPE, is there any coordinating efforts statewide to specifically focus on donations for our long-term care facilities?
So I do know that the governor's office has put together a consortium, like a buyer's network, that type of thing. And they've distributed the list out to us, which we send out to our membership. I don't know whether they're doing any specific buying. I hear that they are. I also hear that FEMA is coordinating and putting some things together on the PPE side as well. But I don't know the exact details. Okay.
We'll follow up on that. So back to the chat questions. So Dave, I know there has been issues about people going out for dialysis and facilities believe that is where COVID is getting back into their buildings. What can our assisted livings do around this issue?
So one of the cool things that Access did, like right off the bat, like in mid-March, they applied for what we call an 1135 waiver. And that goes to CMS and they say, hey, if they ask for a whole bunch of things. I think they had like 38 pieces on there. One of those was in regards to dialysis. Medicare pays for dialysis. And so you have these Medicare dialysis units and people send them out, you send your residents out to them. Yes, the residents, some were coming back, whether it was from the dialysis unit or the transport or whatever, we're not quite sure, but they would come back with COVID and then you'd get it in the building. Well, Access petitioned CMS and CMS said, yes, what you're able to do is go to that dialysis center. Instead of going there, have them come to you. So that's one of the things one of the issues that around the country that we're able to kind of put to rest is to be able to keep people in their homes or in their rooms to be able to do dialysis right there in the building.
And then I kind of have a comment too.
Yes.
One thing our company has done, facilities that are located kind of in the same area, they've made one facility kind of the place where the long-term care will stay. So they've transferred a lot of the long-term care residents to one facility. And then that facility sent over a few of their skilled patients, and skilled is anyone coming from the hospital needing nurse or therapy care for a short-term stay. So one facility will accept new admits from the hospital, and the other one kind of just shelters in place with all the long-term care, kind of to preserve lives, to make sure this thing doesn't enter the building. Because every time someone enters your facility, like transport, whether it's x-rays, physicians, things like that, the risk increases. So that's something we've done. I know a lot of the facilities that don't have that option, they've put up like makeshift walls. They've dedicated certain wings. You can do that in assisted livings as well. So your high-risk people that are constantly going out, they can also be in a more secure section.
Very good. And I see Representative Pollack joined. So if you just wanted to say a quick hello, I can unmute you. There you go. If you wanted to say hello, Representative Pollack. Oh, for some reason, am not able to unmute you.
There we go.
There we go. There we go. Just
Thank you
hi.
so much for hosting this. This is one of my favorite caucuses to participate in, so I'm so grateful to be here with you today, and it's nice to see so many people on the call.
Yes, I think we're at 87 right now, and so far so good. No technology challenges, so we're going to keep going.
That's great.
We have another question from Scott. So obviously, Dave, you're the man of the hour, so here's a question for you, but other people can chime in as well. Who from senior living is helping the industry with the discussion with the media who reports the outbreaks, but from our perspective, or from our point of view, to explain the issues and to describe some of the truth of the lack of PPE and staffing challenges? It feels like a beat down of the industries, and more directed dialogue could be helpful from providers. Dave, would you like to take that?
Yeah, I totally agree. There's not a day that goes by where I'm not talking specifically to reporters. And first off, trying to set the record straight on what they think a nursing home is. So it goes across the board on what they think. I mean, they look at an independent living center as a nursing home. And it's so trying to set that record straight first off has been climbing a mountain. The other piece about, talking to them about PPE and what's going on with staffing and things like that, it's never ending. I mean, there's not a day that goes by, like I said, when we're talking to reporters and just saying, okay, this is exactly what's happening in some of these buildings. And of course, they want names and they want a profile and they want to do the human interest side. And we're just trying to back off on that because we don't want anybody to get uncomfortable or especially residents or anything like that. And we certainly don't want to send the news into buildings, which is what they really want to do. And it's just more cumbersome that way. So we're trying to be that focus. And I meet weekly through Zoom with our counterparts in other associations of Leading Age, the Alpha affiliate here as well. And we talk, they are hitting up the press as well, or being hit up as well, and having that conversation too. So we're trying to focus it that way if we can.
And I think I saw Pam on the call. Pam, I hate to put you on the spot, and I'm scrolling through because we have 87 participants right now. So Pam, I don't know if you wanted to chime in here, or if you would like, you can just either put something in the chat or unmute. Happy to have you kind of talk about what you're doing in this area as well. And if you want to take a minute to adjust that, that would be great.
Senator Carter, can you hear me?
Yes, I can.
Oh,
great.
Okay, it works. Okay, thank you. I appreciate that. Yes, as David said, we've been meeting weekly, and we've been working very hard to prepare our members for COVID, and working on wings and isolation areas and independent buildings. And we have been working very hard to try to get our members ready. And as far as the media is concerned, yes, we have been talking with media and trying to at least get out some good stories of what we've been doing, because we have been really working hard, and it does not show that in the media. But we have been working very hard, and I know that our members are staying in contact with our families and the community around them. So thank you for this opportunity, and thank you for your work, Senator.
Thank you. It's a pleasure to be here with the group. So at this point in time, we've gone through our speakers, and we have approximately 20 minutes to open up the conversation. I invited a number of researchers to join the call as well. So if you would like, and you're looking at the chat box, please put in the chat box if you'd like an opportunity to say hello to the group, or if you have a question to anybody in the group. I can just, while we're waiting for some questions or conversations to come in, I can tell you right now that what I'm hearing from constituents, from our seniors who are at home and not necessarily in a facility, is they are extremely anxious around masks for themselves and for their families. And that has been the #1 call that I've been receiving. And so we can talk maybe amongst some of the lawmakers or some of the other advocacy groups out there, maybe Maddie, what the Area for Aging is. What can we do for our individuals who are at home who, as we begin to talk about reopening up the economy, and as people still need to go out and receive groceries and food, people are really anxious about masks. So what are you saying to the general public, not in the facilities, but in the general public, about masks?
Yeah, absolutely. I think one of the things were certainly, I think there are a couple things in that question that I'd like to address. First and foremost is about reopening. And I think, of course, I'm itching to get out of my house. It's not that fun. I get it. I also know that the majority of the people who have died are older. So about 70% of Arizona deaths are people over the age of 60. And so we need to be extremely judicious in making sure that we're not, I get the cure, don't make the cure worse than the problem itself, but we shouldn't also be sacrificing older adults to make that cure. So I know it's a kind of a dance, but I just wanted to address that. And then the other thing that I wanted to address is the masks. So it's extremely hard to come by masks. I think everybody on the call can relate to that. There are some groups who are donating masks. I know that each area in the state has different groups, so it's hard as a state agency for me to give you one specific group. But I know in Pima County, there's certainly masks that have been donated, cloth masks. And as many people who can make cloth masks, I know I saw on Facebook, Representative Powers Hanley was making cloth masks for people. So if you're unlike me and can sew, you should definitely do that. I can't. I'm not crafty at all.
Well, that's okay. It takes a village, and we're all working together to support each other. So somebody may be able to source the material, or somebody else may be able to sew, and somebody else may be able to deliver. I do want to take one pause real quick because I don't want to lose the opportunity to introduce Cody. So Cody, if you're, my screen is kind of scrolled. I've lost track of you on our, there we are, Cody. Cody, if you've unmuted, could you just talk a little bit about what you're doing specifically for our senior veterans?
Yeah, I want to say thank you really quickly for everyone for being on the call today. And I'll keep it brief because there's a lot of great questions in there. So I'm a program coordinator for our Rural Arizona Connects project, which is bringing the Be Connected suicide prevention resource for veterans to rural areas in Arizona. And we know a lot of our veterans in Arizona are seniors and are living in rural areas as well. And so we're promoting this resource to the rural areas and to our rural veterans to let them know that they have a place to go if they're looking for a veteran-centered resource. And there's a 24/7 call line, which is incredibly important right now because we can't always go in to a clinic to see someone to get help. And so I'd be happy to share that resource in the chat. But us at the Center for Rural Health are really trying to get that resource out there to people and working with Arizona Coalition for Military Families as well to really help our older adults and our veterans.
Thank you so much, Cody. If you could share it in the chat, and Mary and Andrea will collect that information and send it out. Thank you for doing that. And then I know we have another professor from the University of Arizona, and Professor Anger, would you mind unmuting yourself and just explain a little bit about covidtext.org, azcovidtext.org.
Yeah, certainly. Thank you very much for the opportunity. Myself and colleagues in Tucson, we have started a system which is based on text messaging and a website. And the idea is that people who enroll would receive every 1 or 2 days a simple text message explaining what they can do to protect themselves and their family and to cope successfully with this pandemic. They also have the opportunity to provide information not just on their health status, but also any financial, economic, housing, dietary needs they might have. And this allows us to create a good picture for decision making. For example, how quickly can we come back to normal? We are very, very interested in supporting senior citizens, and I'm in discussions to add more facilities in this site for the use of senior citizens. And and their special needs. And in addition, the point that we're trying to make is that this pandemic affects us not just in health, but in all the other multidimensional aspects of living.
Thank you. Thank you so much. I appreciate that. That website is in the chat, and the chat is providing a lot of resources. Maddie just posted something again. Cody posted his. I'm going to pause here and kick it over to Andrea D'Alessandro, if you wouldn't mind. You had a quick question about the VA in Tucson.
With the Tucson VA, and they were very happy to hear from me. They're doing a lot of telemedicine, a lot of mental health support, and they're also still working with their homeless community. There is a facility there, and they're also monitoring their veterans that are in community health centers and community nursing homes. And I was wondering if one of the panelists could tell me if they have a contract, or their association group has a contract with the VA. But before I get an answer to that question, I have a lot of confidence that things are being managed in the Southwest better than the other VA hospitals. It seems that California, Arizona, New Mexico are in a coalition of all the VA facilities, and if someone's short of something, they work collaboratively. So I was very impressed. But my question was about the veterans that are in nursing homes under VA contracts, if anyone provides services to those people. No, maybe not.
Yeah, so the area agencies on aging, so in general, we do provide services to veterans because many are over the age of 60. But specifically, Maricopa County, the Area Agency on Aging Region 1, I know does a little bit of VA program, and down in Pima County, Pima Council on Aging also has a contract with VA for directed care. So I know that there are some area agencies that do, but some don't, but it's always a great place to start.
Thank you, Maddie, for answering that. And I'm going to work up from the bottom on the chat group. Marie has a great suggestion. Along with providing the public with the cloth mask, it would be helpful, especially to our seniors, to provide some training on how to properly wear the masks and then how to care for them. I know, I'm not a doctor, but I'm getting a lot of questions about this. So maybe we could put together as a group, and that could be something that this group makes and works with a couple of our providers and our experts on here, with maybe some medical providers, on what do you do with cloth masks? How do you handle them? How do you wash them? What's the proper way for fit? That might be something that this group can come together, and I think that's really important. Melinda, I know there's an email there, but I'm not sure what the yes is to, so if you could just put that in the chat. And then working back up from the bottom, Scott had a question, because we still have about 10 minutes left. Scott has a question. Has there been any discussion at DHS or anywhere that might be opening some COVID-only facilities for people who are positive, contagious, yet not so ill they need to be hospitalized, or maybe asymptomatic? This may allow assisted living centers to temporarily move the infected residents to protect other residents and staff. That's a question. So think about that. And it kind of coordinates with the question from T. Brown, and I don't want to assume who any of these names are, but interested to know what steps are being considered for safety and concerns of the staff members coming and going from their places of employment and possibly bringing in contamination. So if somebody could answer that, then we'll kick it off with Belinda after that, back to PPE for our facilities. So Dave.
I'm going to address the part about what you're kind of referring to as a step-down facility. One of the pieces that we've been talking to DHS about, between Pam and I, meeting with them at least on a weekly basis, is how to set up facilities that are all by themselves, that are COVID facilities. St. Luke's being one. That could be, some of those floors could be used as a step-down facility type thing, where you could send folks to. So that was one avenue. There's 3 or 4 large places that they've identified that they can do this or are doing it to. The Army Corps of Engineers has been here for a little over a month now to try and get that established. we've also been working with some of our members who they had COVID in the building early, and so they're able to use that building as a just make it all COVID for the most part, or to once it's out of the building, use it as a step down as well for COVID. Now that's skilled nursing, so you can't really do that from assisted living to skilled, but there are those talks being happening. And this is really important too, from the aspect of if this thing comes back in the fall, are we going to be ready for it? And this is part of that whole continuing conversation.
That's great information, and I do think that the lessons that we are learning here will help prepare us for the long term, because we know that we will be continually concerned about this for a time being, this side of any type of vaccination and treatment. So transitioning from that, let's talk a little bit about the testing. This has come up in our chat. We heard from the governor's office yesterday the testing blitz, and there was a great article in the Arizona Republic about what that is. So if anybody has any information around testing specifically for our seniors, and maybe even describing a difference between the nasal tests and the blood tests, and what the difference are between testing for antigens versus an active case, if we have any medical experts. And if we don't, we can make that another call. We could bring the group back together and make that another call. So I will kick that question out there to the group, and if anybody has any information or would like to tackle that question, feel free to unmute and answer. Don't everybody talk at the same time. I will say this, I will start, the University of Arizona specifically has partnered with the governor's office to do testing for our first responders and our healthcare providers. And that website is going live here by the end of the week, where you will be able to register, and you will go through a series of questions. They're not testing patients who have symptoms. These are not for symptomatic patients or people who have been exposed. It's for the healthcare workers to get an antigen test. And so that will be scaled up. The kickoff is May 1st, which is Friday, but they're going to try and go live on Thursday. And we have partnerships across the state of Arizona to make sure that is rolled out across the state, not just in a particular geographical area. So that's one piece of testing. The second testing announcement was yesterday by the governor, the testing blitz. And I know that there's information in not only on the governor's website, but in the news today. Mary, maybe we can grab that information from the governor's office and push that out as well. There's a number, for example, Banner up here in the Phoenix area has set up testing at the Memorial Coliseum, and you can call, you go through a series of questions. They will determine whether you should get tested or not get tested, and then you can go there and receive the test. And there is a cost associated to it, because there was a question on here about cost, and that was listed in the announcement as well. I don't have that information. I'm going off of what I read this morning. So it's looking like there is a couple of resources online here. Donning and Dofi PPE, great resources for education and free Zoom meetings. That's listed on there. Amanda from the University of Arizona College of Public Health, considering implications for well-being of older adults, what are we doing about elder abuse, mistreatment potential, given what we know about conditions that increase the likelihood of occurrence? Mandy, if you wouldn't mind answering that question really quickly, and then we'll go to Weldon's question about grocery stores. So Mandy, if you could answer that question, that'd be great.
Dr. Sokin, I think that the AAAs, we all offer some form of quasi-legal services. And so people can call into us. We also are mandatory reporters. So, well, for the most part, our ombudsman program is not. But for the most part, we're mandatory reporters. So if we do hear of abuse, neglect, or mistreatment, we do report that, or at times we encourage somebody else to report that to APS. So we're doing a broad-based campaign, especially down in Pima County. I know we wrote a whole section on scams and fraud in our newsletter. So definitely connect with me after this and I could go over a little more.
Thank you about that. And I do want to recognize Lisa O'Neill. Lisa, I hate to put you right on the spot. You're on the second page, but if you wouldn't mind, I'm going to go on ahead and unmute you. And if you just wanted to say hi to the group from the Governor's Advisory Council on Aging, and maybe we could work with you to get that information from the governor's office, because it was just an announcement yesterday. So we're brand new to this new testing protocol that will be in place for the state of Arizona.
Sure. Thank you. So hi, everybody. I'm so sorry I joined late, but I was on a call with the Governor's Office of Youth, Faith, and Family regarding our Governor's Advisory Council on Aging transition into that new office. So that was a really informative call, but I'm sorry that it conflicted with this meeting. Sounds like you guys have had great conversations, and the council is willing to help with whatever you guys need coming out of this meeting. Just let us know. I'll connect with Mary afterwards and see if she needs anything.
Thank you. And I think the big question was about the governor's announcement yesterday of the testing blitz, and specifically getting that information out to our seniors and for loved ones who care for seniors, so that they know how to receive tests if they meet the criteria for receiving the test. Great, and so I'm gonna try and finish up here in the last 3 minutes. There was a great question on here about going to the grocery store. Before we get into that, I do want to kick it back over real quick to Dustin. Dustin, you could do a quick answer about wearing masks in facilities, because that was one of the questions. So I unmuted you. Dustin, 1 minute, go.
Before employees even enter the facilities, they're screened right at the doorway with their temperature, so we know that they don't have any symptoms. They have to answer very detailed screening questions. We encourage them not to leave their community. They have to understand that in the facilities, we're the ones that are going to be bringing it in, or it could be, you know, another lab or x-ray. So they stick to that. Our company has rolled out N95 masks for every one of our employees, every department, from activities, dietary to clinical. So everyone's wearing N95 masks that are good for up to 5 days. We also keep either a cloth mask or a surgical mask over that. Again, not every company has that luxury, but that's kind of what we're doing for that. And I think we need to remember washing our hands is what's going to help kill this. A lot of times we think wearing masks, that kind of protects us from getting our germs on our residents, on our seniors. But if you're going to the grocery store, wash your hands, take antibacterial soap with you. Remember your cell phone, we're touching that constantly, disinfect that.
Right. That's great advice. And Weldon, I'm going to conclude with this question before we just make some final comments. Weldon said, when going to the grocery store, it appears that the older people consistently wear masks, but younger folks not so much. Is there any public education effort to encourage younger people to wear masks in public, not only to protect the older population, but to protect the public in general? This would seem to be a factor in accelerating reopening the economy. And I think that's great advice. I will definitely pass that along to DHS. If you're watching TV at night, you can see that Kara has become quite the superstar on commercials. She has done an excellent job of providing information from DHS to support what the CDC is putting out there for public awareness. I want to say thank you to all of our TV broadcasters. I'm not sure if they're having to pay for those commercials or they're just putting them out there as part of public service. But the more we can do as a community to push that information out as well. And a lot of times, and I will kick this off to any of the elected officials that would like to make a closing comment. My closing comment is, I feel like my constituents are comfortable talking to me, and they can hear, you know, things on the news, and they may be able to see some things on social media, but that personal touch has made all the difference in the world. And so it's not that we're saying things that are different than what the CDC is putting out for guidelines, but they really feel connected when they can hear that from somebody that they trust and they have worked with. So the more we can do to reach out to especially to our senior population, I think the better we can do to serve our constituents. So would any other elected official like to make any final comments before we conclude recording and then conclude the meeting? Anybody? Leela, would you like to make a final comment? I'm going to unmute you real quick. Hold on 1 second. I don't know why I can't unmute Leela. I keep clicking unmute. There we go.
I think I unmuted myself, or we did it in a bipartisan way at the same time.
That's right.
I like that. One of the things I would like to suggest is to look local. I know that we have neighbors in my neighborhood who have posted signs on our doors and said many of our neighbors are elderly and we would like to help you. We'll do grocery shopping for you, you know, whatever we can do. And if you're a person who can help, please sign up. And that's like local to my street almost. We also have our political legislative district 24 group also making those offers to run errands and pick up things seniors or anyone else needs, maybe someone who is compromised medically but isn't necessarily a senior. And as to masks, we have a couple of groups in our neighborhood that I see through Neighborhood Next Door who are making masks and selling them for a small price, or making masks and literally giving them away. And so that's another unexpected resource where you can get homemade cloth masks either for free or for a nominal cost. So there's a lot of people pitching in, and I'm so proud of all our folks who are doing what they can, and every small act adds up to a huge difference in how we face this pandemic together. So thank you, Senator Carter, for having us get together. And I'm thrilled that we had 87 or 87 plus on the call today. And thank you for your leadership in so many ways that we're facing right now. So thank you.
And Andrea, did you want to say something? Oh, I think Andrea waved goodbye. Okay, well, we're at the end of the meeting. I know there's a couple of people that are still online. If anybody wants to quickly unmute and say goodbye, happy to have that. But we, at our high water mark, we were at 88, Leela. So this definitely worked. And we I think, survived the technology. So this, it has been recorded. I'm going to click stop recording right now, and then we will push this out to the rest of the group. I just want to say thank you to the elected officials who have joined us today. This definitely is a commitment of ours through the years, and we're not going to let a little social distancing stop us from coming together to support our seniors. And so this has been an honor and a privilege to do this. We will be having a May meeting, I think. So Mary and Andrea will work together on that. This worked really well. And we could even convene smaller groups of people that want to talk about something specifically. It really is up to the group on how they would like to continue to move forward. Otherwise, we'll continue with our regularly scheduled meeting. I just want to say thank you. I'm going to click stop recording.